Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. In today's show, I'm going to answer 6 key questions about stimulants, from cocaine and caffeine to methamphetamines, including why they're used and misused, their role in the drug overdose epidemic, and how to get help for stimulant use disorder or addiction, which is not uncommon among celebrities like Robin Williams and Robert Downey Jr. Cocaine addiction sadly led to the untimely death of Whitney Houston, who died at age 48, and John Belushi, who died at 33. Let's get started. Number 1, what are stimulants? They're a class of drugs that can be highly addictive and can cause severe medical complications. They can be legal or illicit. The most common legal stimulant is caffeine. Prescription stimulants include methylphenidate or Ritalin and amphetamines or Adderall. The most common illicit stimulants are cocaine and methamphetamines. Street names include coke, crack, blow, meth, speed, and uppers. Question number 2. Are stimulants involved in the drug overdose epidemic? Yes. Sadly, stimulant use is on the rise. During the opioid crisis, overdose data showed that cocaine and psychostimulants had similar increases in death rates as opioids. According to the Centers for Disease Control and Prevention, CDC, stimulant-related overdose deaths increased from 547 in 1999 to over 16,000 in 2019. That's an increase of 772%. Question number 3. How do stimulants work? They bind parts of the brain that activate the reward pathway, which leads to excess dopamine, i.e. the pleasure neurotransmitter. Acute stimulant use can cause significant cognitive changes, hence the term psychostimulants, from increased alertness and attention to paranoia and psychosis. Other effects of stimulant intoxication include rapid heart rate or tachycardia, high blood pressure, rapid breathing, hypersexuality, seizures, coma, and in some cases, death. Question number 4. Why do people develop stimulant use disorder or addiction? There's no one single factor that can predict who will develop an addiction. However, adverse childhood events, or ACEs, are strongly correlated with stimulant use disorder, particularly household substance use and childhood sexual abuse. Other risk factors include a history of psychiatric disorders, such as depression and attention deficit, and alcohol use, which can extend the high of stimulants. Question number 5. Can we use better language? Yes. Society still uses highly stigmatizing and harmful words. Instead of addict, junkie, or crackhead, say person with substance use disorder or a person who uses drugs. Instead of drug abuse, say risky or unhealthy drug use. Instead of addicted or crack baby, say newborn with substance exposure or neonatal abstinence syndrome. Instead of delusional, nuts, crazy, say altered perception of reality. Question number 6. How can stimulant use disorder be treated? The most effective treatment is behavioral therapy, including contingency management, cognitive behavioral therapy, or CBT, and trauma-informed care. Right now, there are no FDA-approved medications to treat stimulant addiction, but there's promising research with topiramate, or Topamax, for cocaine addiction, and mirtazapine, or Remeron, and naltrexone bupropion for methamphetamine use or addiction. Harm reduction approaches are also effective, and they include safer consumption supplies, naloxone, fentanyl test strips, STI or STD screening and prevention, immunizations, and mental health support. So, how can you get involved? Learn more about addiction, harm reduction, and treatment. Ask people who use drugs what they need and how you can help without any judgment. Your compassion will go a long way. You can also donate to, volunteer with, and learn more from Boston Medical Center's Graken Center for Addiction, the CDC, Yale Medicine, the American Society of Addiction Medicine, and many more. Well, that's all for today. Here's your joke of the day, doctor theme. A patient comes to the clinic with a cucumber in his ear and a carrot in his nose and says, "Doc, what's wrong with me?" The doctor says, "You're not eating right." Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.